Post-traumatic stress disorder is a mental health disorder that many people who have witnessed or experienced a traumatic event may struggle with. Frontline workers have been dealing with COVID-19 for nearly a year now, and some say it's ugly.
Yes, I do feel a lot of emotional fatigue. The most difficult part for my family is when I get home, I have nothing left to give emotionally. It's almost shutting, sorry, it's almost shutting down. It's being emotionally unavailable for your family because you've given everything that you have.
Lakeisha Johnson, an ER nurse, says that burnout is a big issue in hospitals right now and that she is personally feeling the strain. And she's not alone. A study done in October by the University of Turin in Italy shows that up to 35% of frontline healthcare workers experience traumatic stress symptoms just because of the nature of their jobs. That rate is expected to increase because of COVID-19. The director of pastoral care at Augusta University Health says it would be naive to think that frontline workers won't be affected.
We need to be watching our healthcare workers very carefully because no human can continually experience the things that we're seeing and have it not affect them.
Flowers says that patients are not just a number to healthcare professionals, so when they watch people suffer, it's difficult. He says a team of counselors consistently reaches out to hospital employees to check in. Hand in hand with PTSD is the concern about suicide.
But the thought of losing them to professionals to suicide or just depression and despair that takes them out of being able to live their normal life is overwhelming.
Flowers also says that healthcare workers appreciate the support, but there is one thing people can do that will really help.
Best thing you can do for us is to show us you take it seriously. Stay out of large groups, wear the mask, observe the protocol.
Johnson says if we all saw what she is seeing, then taking the virus seriously wouldn't ever be an issue.
And that's one of the things that COVID does is people can't take a breath. They try their best, but what they're able to bring in is not sufficient for life. And it's essentially, it's like almost watching them suffocate to death.
Johnson says that because of privacy laws, many frontline workers don't feel like they can talk about what they're experiencing. That makes dealing with their trauma that much harder. Reporting in Augusta, I'm Kim Vickers, WJBF, News Channel 6.